we make it easier for you to posture in a way that takes pressure off your nerve. So if I was sitting here like this all day, that would be harder on my neck. And if I can make it easier for that person to do that. Also, wherever that nerve goes, it might be tugged on by the muscles. So we relax the muscles around that nerve and help that nerve glide better through the soft tissue.
You would untie a knot if your rope was kind of tied up in the middle of a room and you're untying the knot. What the acupuncture is doing is pulling from the end of the rope to straighten it. And so think of it that way, where we want to get a clear pathway from, from localization, or the local spot where the pain is, all the way down to the tips of the fingers where the nerve pathways run. And if you can do those two things simultaneously, where you're removing the local block and then you're basically stimulating the nerve pathway all the way down to the end of the periphery, or pulling the rope at the end, then you create a complete healing mechanism. Welcome everybody. We are here with, this is Ryan Diener and Dr. Todd Johnsonbaugh. We are excited to have a dialogue here and get into chiropractic and acupuncture and how they can be used to help you. So Dr. Todd, why don't you introduce yourself and tell everybody where you are and where you're from?
All right. Well, thank you, Ryan. I'm Todd Johnsonbaugh. I'm a chiropractor in Columbia, Maryland. I've been there for over 22 years. And Ryan, I'm so excited to talk about health providers coming together, because I always feel like when chiropractors and acupuncturists come together, it's like 1 + 1 equals like a million. It's better than the sum of the parts. It's synergistic and it multiplies in the healing response, I believe. So I love it when we can partner with good folks like yourself.
Yeah, great. Well, I feel the same way. And one of the things that we've always talked about in this field is how challenging it can be to combine forces, because we all have the ways that we see a patient and the ways that we think that the patient can be helped. And the patient is really the most important person in this whole equation. And so what's the best thing for them is really what we want. And that gets very confusing for an individual that doesn't know much about acupuncture or chiropractic. Where should I start? What should I do? How do I combine the two? And all these questions kind of arise. And so then you just go, okay, well, I'll just throw a dart and see where I land. And we'd like to kind of, pop that bubble a little bit and demystify it and talk about how we can work together.
Yeah, I think that's great. So why don't we talk about, I'll let you grab. Do we want to talk about how we can pair up, obviously, the implications for chiropractic, the implications for acupuncture go far beyond pain. But just for the sake of our discussion over the next couple minutes, why don't you want to talk a little bit about like neck pain and you're traveling down the arm, or you want to do like low back and sciatica? You start, Ryan, and where acupuncture does it, and then I can do chiropractic. We'll go from there.
Fantastic. Let's go with neck pain. That's just, since you mentioned that first, and I think that's a great place to start. It's obviously a strength of chiropractors, and it's an area that we see probably, top 2 or 3 things that we see as well. So it would be great to talk about how they can work together. So so again, I'm Ryan Diener, and I'm an acupuncturist and the founder and director of Holistic Health Associates here in Frederick, Maryland. And so, neck pain.
Look, how long you guys been there?
So we've been here since 2000. We started in 2005. Okay. And so our mission is to guide patients to reclaim the best version of their health and optimize wellness. And so, for the last 15 years, we've been really trying to make inroads in the community, make sure that acupuncture gets demystified, is brought out to to anybody that wants to try it. It's one of those things that I think when we started in 2005, it was such a fringe medicine. And now, 15 years later, we've noticed people are coming to us who have who just find us on the internet because they heard that it works for whatever for their condition. And so, yeah, it's been a great journey. How about you? Let's start there as well.
Well, yeah. So I've been with Dabs Chiropractic in Columbia for, gosh, I guess 22 years. So it's been great. I had a practice before in California. But when it comes, yeah, and we love, it's so funny how you talk about demystifying, because it's really interesting that, like, now a lot of times I'm the first choice that people are going to, and you've probably seen that yourself, Ryan. But now
Mhm.
people are going, you know what? I don't need I know that's what that's about, but let me see what the acupuncturist has to say. Let me see what the chiropractor has to say first. And that, okay, to be just frank, freaks me out. I'm not used to that. That it's pretty amazing.
It is amazing. It is amazing. And it's funny on that same, theme, 2005, we reached out to so many different physicians and different, potential integrative medical partners and, referral partners. And very few of them were interested in finding a referral partner with an acupuncturist. And now we have many, and many different fields in medicine as well. And so it's interesting how things have kind of come full circle to some degree, from a medicine that was the only medicine back, 1,000 years ago, all the way up to now, where where it's kind of finally coming back into vogue in the current medical system.
So tell us more about how acupuncture treat neck, and then we'll go from there. I know, and you help me out. From my understanding, when my patients come in, they go, "Hey, Todd, do you think it's right for acupuncture to me?" And I go, "Yeah." I said, and I'll tell them when I look for it is, they go, "Well, what have you done, Todd?" And I go, "Well, we've removed mechanical interference on the nerve. We make it easier for you to posture in a way that takes pressure off your nerve. So if I was sitting here like this all day, that would be harder on my neck. And if I can make it easier for that person to do that. Also, wherever that nerve goes, it might be tugged on by the muscles. So we relax the muscles around that nerve and help that nerve glide better through the soft tissue." They go, "Well, what does acupuncture do?" I say that acupuncture kind of tunes down or tunes up the nerve itself. So we help with the mechanical interference, but the acupuncture helps that. Can you explain that more, though, for me, Ryan?
Yeah, it's a great, I mean, the way you're describing it is actually quite perfect. And so let me just add a little bit of color to it. So I think the way you described chiropractic was awesome, because I haven't heard it exactly that way, but the idea of removing the mechanical interference is beautiful. Kind of like the way you would untie a knot if your rope was kind of tied up in the middle of a room and you're untying the knot. What the acupuncture is doing is pulling from the end of the rope to straighten it. And so think of it that way, where we want to get a clear pathway from localization, or the local spot where the pain is, all the way down to the tips of the fingers where the nerve pathways run. And so many of the points that we use are actually in the periphery, which means in the hand, in the finger, in the arm, because that's that pulling on the end of the rope kind of analogy. And if you can do those two things simultaneously, where you're removing the local block and then you're basically stimulating the nerve pathway all the way down to the end of the periphery, or pulling the rope at the end, then you create a complete healing mechanism, because now you're getting all the way through the entire pathway without interference. And so our focus typically is on the periphery, and then we do localized points for calming down the muscle tension, increasing blood circulation, and regulating some of the gases that are in that region. But really, that rope analogy is perfect for what we do. And I think it dovetails in beautifully with what you were talking about.
Yeah, and I love that. And then at the same time, you might go, "Oh, as an acupuncturist, you might go, you know what? I sense that you're kind of stressed out. Let me do something to down regulate your nervous system in general." Or oh my gosh, your gallbladder is overpowering things and causing this cascade of events. We need to do that. So I like the holistic approach to things there. I think that's excellent.
Yeah, and I think again, I think it works so beautifully with chiropractic because the theories are so similar. So from an acupuncture standpoint, we are looking at what's the best way to systematically maintain the body at its own natural healing, mechanism.
Right.
Where are those small blockages occurring? Where do we need to free up blood flow? Where do we need to free up nerve conduction? Where where do we need to regenerate? And so if there's stress on the system, psychological stress or emotional stress, then that causes an over-inflammatory response or an overactivity in the central nervous system, which I'm sure as you know well. And so what we do is we look for, are there relationship factors, meaning are there certain aspects of what this person's story is that point to different areas of the body that may not be right on the brain, but actually can relax certain pathways, certain types of emotions, certain types of blockages or pain receptors. So tell us a little bit about how chiropractic works in that fashion as well, because obviously with the spine being the primary area where the major nerves are coming through, can you go into a little bit of detail about how that works from a systemic standpoint?
Yeah, real simple. So chiropractic theory typically teaches that, hey, when a bone or goes out of place, it can create a series of events. It can create localized pain in that area, wherever that is. So if I have pain at cervical vertebrae number 6 that I'm pointing at right here, that can go out. If that is not moving well, relaxed movement, that can create pain in that area. But that pain can be perceived over a larger area. It can go up about 6 segments, or it can go down about 6 segments. So you can do that. Also, you're going to get the muscle, an imbalance in muscles with that event. And also what can happen is you might have interference on the nerves. And as a result of not proper movement, you also have some hormonal imbalances. So when you receive an adjustment, now good chiropractors will adjust real thoroughly the bones of the spine. And I think they'll do a good job going all the way up and all the way down. Now, the thing is, as you talk about the different layers, it starts to distinguish more, it starts to kind of, most everyone does spinal adjusting of some sort. But as we start talking about, well, not everybody does the extremity adjusting. All right, that's a smaller group of folks. Not everyone gets the muscles and works on the muscles. So that's a smaller group. And now not everyone, the fascia that can connect the fascia we now know is kind of like that casing that's around a sausage. And that can have adhesions. That gets smaller. So adjustments can be done to all of those fibers. And finally, also, you can adjust not to just take pressure off of a nerve, but you can adjust the muscles to take tension off a nerve that we're talking about.
Mm.
Chiropractors are going to get the bones moving better of the spine. They're going to get the bones moving better of the extremities. They're going to get the bones moving, they're getting the soft tissue, the muscles moving better. And finally, they're going to release the soft tissue. It helps nerves out. Biggest change in chiropractic is some chiropractors are finally asking the question, why is the bone out of place in the first place? Why is it stuck there? So they're not just seeking to destroy go, oh, it's stuck right there, we have to get it. I go, dude, what's the reason for that bone to be out of place? Why does the body think that that's important? Why is it important? Let's honor this. Body is intelligent. It doesn't just lock things for no apparent reason. So we want to make sure we honor that. So when you're looking for a chiropractor, you want to get an idea that the chiropractor has a broad breadth of tools and techniques to address those different components that we were talking about, so that they can hone in on what you really need. And to do that in a way that's comfortable for you and approachable, so that the chiropractor can celebrate where you are, so you go, you know what, we can really connect. And Brian, you were talking about that. You really want to connect where that person is, and you want to, hold them there, brace them there, celebrate where they are, acknowledge why are they in that state, and then we can move them forward. And now with the help of acupuncture, we can move them forward and up to a higher level.
I love that. I love that. I think that that's so important, is what you said there in regards to looking at not just the fact that there is a bone out of place, but why is the body actually creating that in the first place? Right. And that is such
acupuncture, more an acupuncture point of view, isn't it?
Absolutely. That's why I'm resonating with it, of course, So I think that that's such an important piece, because we're always trying to go backwards a step. We're always, a really good acupuncturist will look at what's going on, and instead of saying, okay, your neck hurts, let's get your neck feeling better. That's of course going to be a part of it. That's what everybody wants. But the question is how and why is it there in the first place? And how do we go behind a step, go back a step into the place where the body is creating this imbalance in the first place, and say, okay, not only are we going to work locally to release the tension that you have now, but now we also want to see, okay, why did that come in the first place? And then how do we also recalibrate that challenge so that you just don't get this recurring loop? And that's a really common thing that we see, right? Don't you, where somebody feels better, they disappear, and then 6 months later they're back on, like, my neck was feeling so good and now it's hurting again. And so so much of this is about taking the time to get back to the root of where that came from, taking the time to allow that adjustment to occur, literally or figuratively, right? And then being able to have that improvement hold and actually become a stronger aspect for the patient than what they had prior to the injury in the first place.
Yeah, so definitely is some synergism there. So I think when chiropractors are recommending acupuncturists, they should do that. Now, also, I think, Ryan, you really articulated well the difference between acupuncture and dry needling. We were talking about this before, and dry needling almost to me seems like it hurts there, stick a needle there. That's not going behind the scenes. That's not all the steps here. And hey, I'm not bad-mouthing dry needling. It's a time and a place for everything, and a lot of people swear by it. But I think if you want to take it to the next level, and I always recommend acupuncture.
Yeah. Well, it's a whole. I'm sure we could speak for hours just on that subject in and of itself. But just in a quick snapshot, the thing that I love about dry needling is that it's exposed a lot of people to needling itself. Like, people have tried it because they went to their physical therapist, and now they have had the experience of it. So they actually, in some ways, it can help, kind of just get more people in the mix, right? The other thing that I like about it is that technique is one of 9 different needle techniques that acupuncturists are taught. And so that particular technique is really effective when you're dealing with athletes, dense muscle tissue, very intractable issues in people that have a fair amount of body weight or girth to them. Those are really good times to use dry needling. And there are 8 other styles of needling that is important to be aware of, so that, you would never want to do dry needling on a patient that, is 5 foot, 5'5", 110 pounds. You know what I mean? Because essentially it's going to be too much. Yeah, it's going to be too strong of a technique for that person, or someone that has fibromyalgia or some kind of peripheral neuropathy, where they really need a milder technique because the body is taking pain signals and it's accentuating or exacerbating those signals, right? So you want to use a very mild technique with those patients, and they respond much better than if you use a strong technique like dry needling. So it's about just knowing what to use and when, and then being able to differentiate that way.
Awesome. I think this gives people a really good sense of what to expect. When my patients are looking for acupuncturists, obviously I'm going to send them up to Frederick, but if they have to find other ones closer to home, what are some quick things you can leave us with when they're looking for an acupuncturist to go, you know what, this is a good place to start?
Yeah, sure. Look, I appreciate the question and appreciate the dialogue, but I think the main things are, you want to look for somebody that has, at least in the state of Maryland, we're called licensed acupuncturists. If it doesn't say LAC next to the name, it means that the person hasn't been through the full program. So that's the first thing that you want to look for. The second thing that you want to look for is, what is the experience level? Just like you were talking about, is this person working with a particular diagnostic technique? And if so, that should be part of the treatment, your initial consult. You should, if you go to a practitioner who is not doing some sort of diagnostic technique with expertise, most of us learn pulse diagnosis, where we're holding on to your wrist and we're checking for specific challenges that might show up in the resonance between your radial artery there. That's a technique that's been around for 1,000 years, and it has a ton of history, thick books written about it, how you diagnose. So, providers should be using pulse diagnosis and tongue diagnosis, should be looking at your tongue, potentially looking in your eye, at the very least pressing around and touching some different areas of your body. If you're not getting some kind of diagnostic technique at the very beginning of care, then that would be a red flag. And so I would want to make sure that I found a practitioner that was doing something at the beginning that was differentiating your condition versus anybody else that might be coming in with neck pain.
Right. Perfect. Well, that's excellent. Ryan, thank you so much for your time. And I gotta say, this was, like you said, you and I could hang out forever and keep talking.
I'm sure of it. I hope this is just the first of many.
Future videos to come. What? I don't know. Like when there's not COVID, we'll bring a patient in and treat them together and go, okay, now tag team, now you're up. Okay, now you're up. That would be so epic. I would love that.
I would love it too. Let's make it happen.
All right. Excellent, man.
Thank you, sir. This was a lot of fun. I appreciate your time and look forward to the next one.
Awesome. See you.